Hello, everyone. I'm Solomay Tibabu. I'm the host of Going Digital Behavioral Health Tech. We've got a great conversation ahead of us with Chris Botts and Jacqueline Marks today. Thank you both for joining us. To get started, how about some quick introductions? Let's go Jacqueline and then Chris, if you can just brief background to get started, please.
Sure. I'm Jacqueline Marks. I'm a senior manager with Manatt Health out of our New York City office. Manatt is an integrated health services firm that's comprised of a diverse team of more than 160 different healthcare professionals, including lawyers, MBAs, financial experts, as well as consultants like myself. I specialize in the digital health policy space personally. And we at Manatt Health, we like to say that we combine the rigor of legal thinking with strategic and project management disciplines of consulting to help a broad range of clients that we serve thrive and address their most challenging issues.
Thank you so much for having us, Salome. I'm Chris Botts. I'm the Care Delivery and Payment Manager at the American Medical Association. As the physician's powerful ally in patient care, the AMA represents physicians with a unified voice in courts and legislative bodies across the nation. We work to remove obstacles that interfere with patient care. We lead the charge to prevent chronic disease and confront public health crises. And we drive the future of medicine by tackling the biggest challenges in healthcare and training of the leaders of tomorrow. Thanks so much again for having us.
Great. So Chris, I might start with you. I know that together with Manatt Health, I heard that the AMA has developed a report articulating the opportunities and challenges of incorporating virtual care or telehealth and other digital tools to accelerate the adoption of behavioral health integration. Who did you bring together for this exploration and why now?
Great question. I'm actually going to take the second part first in terms of why now. I think many of the audience members have probably seen the dismal statistics that occur around behavioral health care in our country, which have only gotten worse over these past few years due to the COVID-19 pandemic. And given this dire need, we recognize that it's more important than ever to expand the adoption of behavioral health integration, or BHI, which we view as an essential piece to solving our nation's growing behavioral health crisis. We also recognize that there are now digital tools, particularly as you noted, telehealth, that can be adopted to accelerate BHI adoption, help remove barriers to timely access to care. And lastly, we also know that in order to successfully accelerate the widespread adoption of sustainable BHI, actions by all stakeholders, so providers, health plans, employers, policymakers, and even emerging behavioral health companies, are desperately and urgently needed. So given all these factors, the AMA and Manatt Health gathered a diverse working group of stakeholders representative of physician practices and health systems, large employers and health plans, and patient advocates to identify opportunities and, more importantly, practical solutions to advancing the adoption and overall effectiveness of digitally enabled behavioral health integration.
And Jacqueline, I know Manatt has done a ton of work in digital health and virtual care. Can you tell us more?
Sure. So Manatt's digital health team works with a wide array of healthcare industry organizations, really with the goal of helping them to achieve their strategic goals at the intersection of health and technology. So we work with a lot of different kinds of clients. We work with health systems on digital and telehealth strategic planning efforts. We work with a handful of different states on telehealth policy design and implementation, emerging companies on business strategy, telehealth policy, and corporate and regulatory legal work. And a key associations and foundations such as the AMA on thought leadership and convenings just like this. And over the past 2 years, we partnered with the AMA on a number of research and thought leadership initiatives in the digital health space. And through this collaboration, we specifically focused on how physicians and other providers can leverage telehealth, among other digital health tools, to accelerate innovative care models such as BHI and address gaps in access to care.
So we've been talking about behavioral health integration for quite a while in our space. I'd like to hear from both of you, perhaps Chris and then Jacqueline, what barriers have stood in the way of implementation?
Again, another great question. As you alluded to, Salome, BHI has been discussed for quite a while. And unfortunately, despite its strong evidence base and several statutory and regulatory changes over the past decades, favorable to encouraging BHI, widespread adoption by physician practices remains the exception rather than the standard across our country. And this was due to several barriers facing physician practices, which include high startup costs combined with low reimbursement levels, complicated and burdensome billing requirements, siloed data, also limited workforce availability. Additionally, in a study that we published with the RAND Corporation back in 2020, we heard physician practices state that they have difficulty estimating the net effects of behavioral health integration, particularly around their financing. And without convincingly calculating return on investment, it's really challenging for physician practices to constantly invest in resources to sustain behavioral health integration efforts in their practices. Jacqueline, what are some of your thoughts?
Yeah, I would say in addition to that, a handful of the limitations or limiting factors, I would say that we have highlighted in the report that I'm sure are not a surprise to anyone here is that there's, obviously a national shortage of behavioral health providers and primary care specialists. There's lack of adequate payment to providers to cover the costs associated with both adopting and implementing and delivering BHI. And then we've also heard a lot, I think Chris kind of just touched on this, but the siloed nature and the inherent sort of cultural differences between behavioral health and non-behavioral health providers, such as, how much time do you spend during a visit, communication style can sometimes be a limiting factor. Also federal and state regulations that can make it really challenging for behavioral health and non-behavioral health providers to share information across care team members is certainly limiting. And then finally, some health plan requirements such as prior authorization, utilization management practices for BHI, et cetera, can result in administrative burden that make it more difficult to adopt this model.
Right. Yeah, I mean, these are significant challenges. And so I'm excited to talk about your findings and practical solutions for moving forward, because this really is a huge opportunity for our space to embrace behavioral health integration. I know that the goal of your work has been threefold, and I'd like to dig into each of those three areas. So how about starting with Chris? What were the key opportunities and limitations the work group identified in terms of incorporating technology to advance behavioral health integration?
Yeah, absolutely. So in order to be able to kind of identify some of those key opportunities and limitations, the group, as you can see in this graphic, identified several opportunities along the BHI patient journey to incorporate technology. So those include tools like screening and intake, clinical decision support tools, and of course, telehealth care delivery. And based on some of those opportunities, if appropriately applied, the incorporation of them can really enhance the patient engagement and treatment, also just supporting integration while also limiting fragmentation of care, or in other words, whole person care, and ultimately generate value for both patients and the physician practices that support them. The group emphasized, however, that technology should augment, not replace, the longitudinal provider-patient relationship. It will not completely replace the need for in-person interactions, nor patient assessments as needed. In terms of limitations, the group stressed that the use of technology within BHI is not clinically appropriate for all available people, nor will it work for everybody. So both patients and providers have preferences related to the use of technology. Some even lack digital literacy or broadband access, among some other factors that are desperately needed in order to be able to effectively utilize them in the specific space. Lastly, there also continues to be a lack of robust clinical or economic evidence regarding the impacts specifically technology solutions have within BHI models to support major regulatory or coverage decisions. And so that's something, again, that in some of the solutions we identified, really trying to move the needle forward in several of those areas.
Mm-hmm. Yeah, that makes a lot of sense. But now, Jacqueline, I'll turn to you for this one. Can you help us understand some of the practical solutions that physician practices and health systems in particular can use to pursue the advancement of digital enablement for behavioral health integration?
Yeah, absolutely. And I think Chris touched on this previously, but just want to emphasize that we believe that all stakeholders in the healthcare sort of ecosystem have a role to play in ensuring that as a healthcare system, we adopt digitally enabled BHI in a way that is patient-centered and expands access to safe, equitable, high-quality behavioral health care. So in our report, we stratify these solutions by different stakeholders. So starting with those physician practices and health systems. So there are some specific opportunities there. First being, there's an opportunity to actually increase behavioral health diagnosis and treatment rates by incorporating evidence-based digital health solutions and enabling technologies into standard workflows. Second, to address that issue of the siloed nature of care delivery that I mentioned, there's an opportunity to implement actually technologies that facilitate better connection and care coordination across care team members that would enable highly collaborative care. We also think that there's an opportunity to increase BHI training for primary care specialists and behavioral health providers by incorporating digitally enabled BHI into standard curricula at universities, schools of medicine, et cetera. And then finally, there's an opportunity to raise the provision of evidence-based treatment into best practice standards by adopting and integrating standard measurement tools into provider and patient-facing technologies by promoting data-driven continuous quality improvement.
Mm-hmm. You brought up a good point earlier that it does require all stakeholders to be involved. So now I'd like to ask you, what can health plans and potentially other payers do to support this work?
Sure. So I think, I think from our perspective, health plans and other payers have a role to play, in particular in ensuring that there's sufficient payment for BHI. They can support practices who are seeking to adopt BHI, and they can help to reduce financial barriers that are experienced by patients. So more specifically, I think there's an opportunity for payers and coverage programs to increase BHI adoption by first and foremost expanding coverage and fair payment with a margin for all stakeholders who are utilizing the collaborative care model and other BHI models that facilitate care management and transitions of care for patients with behavioral health conditions. Second is to encourage the incorporation of technology into BHI by implementing what we call payment parity or equal payment for telehealth and in-person services for behavioral health services that are delivered either via video or audio-only telehealth technologies. There's also an opportunity to make integrated behavioral health care more affordable for patients by evaluating how and when to actually apply cost sharing. There's an opportunity to assist primary care practices in integrating behavioral health by offering technical support, provider training, and regional sharing of resources. This was a really interesting part of our discussions with the stakeholders that we worked with. We are seeing some plans that are offering this type of training, and we think that's really valuable. And then finally, they could expand provider networks and improve access to BHI by minimizing and or eliminating prior authorization or other utilization management practices for BHI services that I touched on briefly can sometimes cause an administrative burden.
And what about employers? Do they have a role?
Yeah, absolutely. I think employers have a really important role to play. In terms of their role, it's really about ensuring that their employees receive timely access to comprehensive primary care services that include behavioral health. So I think employers have an opportunity to enhance coordination, both among themselves, their employees, primary care specialists, and behavioral health providers. And they can do that in a number of ways. One is by just increasing the number of employees who have a regular longitudinal source of primary care. Which also might include contracting with primary care specialists that specifically offer BHI. They can adopt technologies that enable coordination among the providers that their employees seek care from. And they can launch whole person employer-based behavioral health programs with care navigation support to make sure that their employees are getting the behavioral health care they need. And then finally, I think there's also an opportunity for employers to reduce out-of-pocket costs for employees, but by, again, sort of seeking to evaluate how and when they might apply cost sharing.
And now, Chris, I'll turn to you. So policymakers, both federal and state, also have an important role. What are some practical solutions for them?
Absolutely. There's several actions that federal and state policymakers can take. Those include, and we've heard a lot of some of our recommendations around financing, so providing long-term sustainable funding opportunities for primary care practices, kind of similar to what was used for meaningful use program or for the PCMH adoption programs, to support both training and education on the implementation of BHI services. It can also work on making payment for BHI services sustainable for practices on an ongoing basis, providing fair payment rates with margin, as Jacqueline noted, and with federal and state coverage programs for both the collaborative care model, care management and coordination, psychotherapy, and other relevant in-person and telehealth services utilized by primary care practices have adopted behavioral health integration. It's also really important for them to work with health plans and coverage programs to limit the use of utilization management services, as Jacqueline noted, and enforcing behavioral parity laws, and also strengthening network advocacy regulations in order to be able to ensure that there's proper access within their networks, these types of services. And then lastly, increasing federal funding to support growing behavioral health workforce, specifically around, or especially around, psychiatrists and other behavioral health specialists who practice in underserved areas. This can be done through things like loan forgiveness programs or even new and expanded residency and training programs. That's going to be really important. I think technology, again, and digitally enabled behavioral health integration can play a big part in creating a smaller gap between access and care. But really, ultimately, we need to be able to provide and enhance the current workforce in order to really combat the crisis that's going on in the country.
Right. All really good points. And Jacqueline, maybe back to you. What about all of these many digital health companies? What are some practical solutions for them to advance this work?
Yeah, absolutely. I think we'd be remiss if we didn't include them in this analysis and conversation as they're sort of developing the tools that we're seeking to adopt into these models. So I think that particularly for digital health companies, they have a role in ensuring that the solutions that they're designing are evidence-based and support comprehensive digitally enabled BHI. So to that end, our report proposes that these kinds of companies should first and foremost evolve their current and develop new businesses to support BHI, which include addressing patient and physician needs, make sure that the solutions that they design actually complement in-person care rather than replacing it, that they support comprehensive care delivery and enable asynchronous communications as well among patients and providers, which we do think is becoming very valuable. And then second, digital health companies could help to actually generate robust clinical and economic evidence for BHI, digitally enabled BHI, by working with BHI stakeholders to develop national standards for BHI technologies, and by partnering with practices to test those new solutions and develop clinical and economic evidence. I think one thing that we've seen through our research with the AMA on this project, as well as the ROI return on health framework that Chris is going to talk about, I think, in a little bit, is that the evidence base for some of these digital tools it has been limited, but is certainly growing as a result of the pandemic and the uptake with telehealth. So there's definitely a need to continue generating that type of robust clinical and economic evidence.
These are really great suggestions for all stakeholders. So, Chris, I want to ask you a little bit more about AMA's return on health framework to really actually measure the value of digitally enabled behavioral health integration models.
Yeah, absolutely. If you wouldn't mind putting up the graphic, just folks can see a little bit more about the framework itself. The AMA originally created that return on health framework to comprehensively measure the value of virtual care. And as I mentioned earlier in my comments, the ability to demonstrate the comprehensive value that digitally enabled BHI can generate for providers, patients, and really the society at large will be really critical to further driving adoption of integration. So we really see the return on health framework as a useful tool that can be used to help achieve this aim. So we're continue to collect information and case studies utilizing that framework and continue to apply it in the specific space and really see that as an important piece to really driving that full return on health calculations that are important for practices to invest and sustain these types of models.
Thanks so much, Chris. This is really interesting, and I'm looking forward to our audience learning more. Jacqueline, where do we go from here? What do the next few years hopefully hold for behavioral health integration, or any ongoing words of caution?
I'm optimistic. I really do feel like the only place to go is up from here. As we know, the US continues to face a behavioral health crisis that has really only worsened due to the pandemic. And I think during this time, the silver lining is that we've seen that telehealth and other digital tools have become an essential way of connecting patients to much needed services during the pandemic times. We're seeing providers, payers, and states adapt their policies to continue offering telebehavioral health services on a permanent basis going forward. So I think as telebehavioral health and the use of digital tools has become more commonplace and will sort of stick around, I really don't think there's going back on that right now. I think digitally enabled BHI will become a more commonly used model to identify patients who are in need of critical behavioral health services and to connect them with care. So it is my hope that this trend towards a more hybrid in-person and digital care delivery model will drive adoption of digitally enabled BHI going forward. And we're going to continue to monitor and explore these trends and their impact on BHI through our ongoing Future of Health research with the AMA, which is going to seek to assist providers in sort of adapting and adjusting to this new digitally enabled care paradigm.
Speaking of Future of Health, Chris, I'd like to ask you a similar question. What's your hope for the future of mental health care, and how is AMA working to make it a reality?
Yeah, absolutely. I mean, it's pretty simple yet hard. It's really just my hope is that all folks can access timely, equitable treatment for the well-being of their whole person, so both mental and physical health. And really, ultimately, I want to be able to stop talking about integration. We're only talking about integration because especially behavioral and mental health care feels separate. And ultimately, I hope that when we just start talking about care, it's understood that it's talking about both mental, behavioral, and physical health care. And in order to be able to do that, the AMA continues to work to advance at least effective and sustainable integration among other efforts, particularly around the BHI Collaborative that we launched a couple of years ago, which is a collection of 8 of the nation's leading physician organizations dedicated to equipping physicians and their practices with the necessary knowledge to sustain a whole person and equitable approach to both physical and behavioral health care. The AMA is doing a number of other efforts in the specific space. A couple to highlight, we continue to work to help end the nation's opioid epidemic. We're doing this by placing greater emphasis on overdose prevention and treatment, along with better coordination and amplification of the efforts and best practices already occurring across the country. We're also really striving and committed to tackling issues around maternal mortality and morbidity by working with policymakers to promote equity in maternal health care, including access to behavioral and mental health care. And those are just a few of the efforts that we're working towards and we'll continue to strive for to make this a reality for everybody.
Thank you. These are all really important initiatives. How can our audience learn more about your work and how can they get involved?
Yeah, absolutely. So if folks want to view and read the report in more detail, among the other initiatives and activities and resources that we have, they can go to the AMA's website and search BHI or Behavioral Health Integration. And they should be able to find all of the sorts of different efforts that we have in this specific space. And also, if those are interested in either sharing their experiences of digitally enabled BHI or work with us in terms of making these solutions a reality, they can email us at practice.sustainability@ama-assn.org.
Wonderful. Thank you both, Chris and Jacqueline, for the work that you do. And as mentioned earlier, everyone, please check it out. This is important work. And I think that with our collective initiative and support, that we can make these things a reality sooner than later. So thank you for your time.
Absolutely. Thank you so much for having us.